Good afternoon, everyone. It looks like we have peaked in terms of people entering the webinar, and so we want to get started. My name is Jeff Levy. I'm a professor of health policy and management at the George Washington University, and I lead a project there called the Funders Forum on Accountable Health. Welcome to this webinar sponsored by the Roundtable on Population Health Improvement at the National Academies of Medicine. Entitled Equipping Communities to Equitably Use American Rescue Plan Act Funding. Unfortunately, two of our panelists have had emergencies that have taken them away, but I will continue to be joined by Marcia Lily Blanton and Javier Morales, and we will do our best to be as informative as possible, and also to and this will also allow some additional time for conversation and dialogue with you during the webinar. We will be using the Q&A feature for posing questions and comments. Feel free to start that conversation during the presentations. Depending on how good a job I do of monitoring as the presentations are going, we may answer some informational questions as we go along, but save the discussion questions for later on. So this will be a discussion in two parts. My colleague, Marcia Lily Blanton, who is an associate research professor at the School of Public Health at George Washington University, will be joining me in presenting some work that we did through the Funders Forum. And then Javier Morales, who is executive director of the Praxis Project, will provide some responding and additional comments on this topic. So with that, we will get started, and I will see if I can successfully share my screen. And I think I did. All right. So what I'm going to do is start. Marcia and I are going to present some work that we did through the Funders Forum on Accountable Health, where we developed a framework for assessing the racial equity impact of the American Rescue Plan Act. So just a moment to tell you about this project and this work that we were doing. The Funders Forum on Accountable Health is a common table to bring together the growing number of public and philanthropic funders of accountable communities for health type initiatives. And by that, we mean multi-sector partnerships to advance health and address equity and advance equity in communities. This specific work was done as part of an Aligning in Crisis grant from the Robert Wood Johnson Foundation. And that project is a collaboration between George Washington University and the Georgia Health Policy Center. So let me offer a little bit of context for having this discussion. The Biden administration has, from the get-go, literally on day one through their executive order that prioritized equity in the response to COVID, this administration has really been committed to addressing equity in the pandemic response. You combine that with the American Rescue Plan Act in particular, which is providing an unprecedented level of investment in public health, in communities, in a wide range of areas. But this project, we focused in particular on the $350 billion in fiscal relief funding that was going to states and localities. That money was really designed to be incredibly flexible to fill gaps that may have been created because of declining revenues during the pandemic. As it turned out, revenues did not fall as much as expected. And so now states and localities have incredible flexibility in how they spend this money to rebuild, to address gaps, and in particular to find ways to address the particular challenges in our society, both on the economic side and on the healthcare side and the public health sides, that uncovered a lot of the inequities in our society. And in fact, the Treasury Department's interim rule, which is, and frequently asked questions, which is all the guidance that's been given so far, on this fiscal relief money says, and this is a direct quote, these resources lay the foundation for a strong, equitable economic recovery, not only by providing immediate economic stabilization for households and businesses, so that's some of the the entitlement funding that was increased, but also by addressing the systemic public health and economic challenges that may have contributed to more severe impacts of the pandemic among low-income communities and people of color. And so we started this project and this discussion by asking the question, how can government recipients of funding be held accountable for focusing on equity in their decision-making and programmatic choices? We framed the discussion around the American Rescue Plan Act, but it certainly can equally be applied to other funding streams, in particular the new bipartisan infrastructure law. And I think many of us have heard over the last few days, the Secretary of Transportation, Pete Buttigieg, talking pretty eloquently about the historic structural racism and decision-making around transportation funding, and that he sees the bipartisan infrastructure funding that's going through the Department of Transportation, not to repeat those mistakes, but also to remedy some of those mistakes. And so this framework that we're talking about can be applied to multiple funding streams, and also ultimately, if the Build Back Better bill is passed, that could be another framework. I should note that the presidential COVID-19 Health Equity Task Force put out a report this week. That report included some very specific recommendations about accountability for equity and proposed a series of metrics that would allow the government to assess the equity impact of some of the funding that is being allocated, regardless whether it's in any of these programs, throughout government programs. This paper that we're talking about today is slightly different in that it is really talking about the decision-making process, how communities go about making decisions, not just assessing the equity impact of particular programs. And I'll explain in a moment how we got to that focus. And so when we talked about equity in this paper and in our process of developing this paper, we really wanted to make clear that if we talk about equity, we have to be talking about structural racism. And this quote from a New England Journal of Medicine Perspectives piece by Risa Lavizzo-Mori and Richard Besser and David Williams really highlights this notion that we have to get away from measuring individual disparities. We have to get away from measuring individual outcomes and really raise the bar to be thinking about the underpinnings of these disparities, the underpinnings of these inequities is really around structural racism. And thinking about how you remedy structural racism requires a slightly different approach to measurement. And so since the American Rescue Plan Act is about money, it's about pumping a lot of money into our system. And so we're focusing on those spending decisions because at least structural racism is at least in part about power. Who has it, who exercises it, and who benefits from its exercise. And so the very first opportunity to address structural racism is really in that decision-making process. How funds are allocated is a form of distributing power or not, or redistributing power or not. So we identify in this paper some key principles and accountability reporting requirements that address the central question of who is at the table when decisions are being made, and are the communities most affected by the pandemic being empowered in this process. So this can certainly be used by and ideally would be used by the federal government to hold recipients of these funding streams accountable. But it's also a framework that can be used to design a local response or for advocates to use to hold their local officials accountable. Certainly our work at the Funders Forum in developing frameworks for assessment and has always, we start with this process of, well, this will hold grantees accountable, this will hold recipients accountable. But actually, it can also be a roadmap for how people design their programs, so they know up front they're addressing some of these structural issues. So That's the context in which we developed. We held a convening of about 30 people from around the country with various types of experience to help develop a set of principles. And I'm going to turn it over to Marcia now to talk through those principles.
Thanks, Jeff. I also want to ask you if you can continue to roll the slides,
Yes.
and you'll know when I get to each slide. So first, let me thank you for that framing, because I think it helps, the context helps us all understand where we are. And I also want to add my thanks to the National Academies Roundtable on Population Health Improvement for hosting today's webinar. As you've already heard, COVID-19 pandemic has cast a very bright light on racial inequities in health and in healthcare that have been exacerbated by the pandemic. And so what I'm going to do is just briefly walk through the principles at a very high level that we developed to help guide, direct, but also help better assess whether or not the equity goals of the American Rescue Plan Act are being achieved. So the first principle that we developed was inclusive decision-making process. So at the heart of that is just how is the decision-making table being set? It should be inclusive of those who have been affected by the pandemic, and those who have also the responsibility and the capability to address some of the root causes of the pandemic. So let's just talk a little bit about what that means. So it means in part being multi-sectoral, and by multi-sectoral, it means the sectors in our economy. So health will need to talk with or engage those who are from housing. We'll need to engage those who are from business community, who are employers. We'll need to work with the educational system. And sitting at the table, being a part of the table, will have to be those who represent the multiracial, multi-ethnic makeup of that community, of that state, of that community that will be the focus of the allocation of funds. The second principle was meaningful community engagement and participation. So with this principle, the focus is on investing in making engagement and inclusion real. And to achieve meaningful engagement, it means we've got to think beyond some of what we have done in the past. Many of the community groups have limited bandwidth, limited resources. And so it means that we've got to consider place, time, languages that are spoken, how we communicate, how we do outreach, whether childcare is provided. And in some cases, maybe consider even financial compensation, and at the very least, compensation for transportation. So I want to talk a little bit about why this is so key. I mean, I think we've made it clear that this needs to be real, but it becomes key because many of those who have worked in government, many of those who are probably on this webinar who consider themselves thought leaders, have a sense of the problem, understand the problem. But the reality is people who have lived experiences, who come from those communities, can problem solve at a level and with an understanding and a depth of understanding of the issues that sometimes is not available at the government level from people who are detached from the day-to-day. So making inclusion more than just a name on a page or an organization listed becomes real critical for making sure that the equity is really achieved in how these funds are allocated. The third principle that we developed was about implementation. And when we talk about implementation, we realize that we spend a considerable amount of time in planning, which is what we should, but we have to also make sure that the execution and the implementation is considered. And one of the suggestions that we had for how you can make sure that we're not reinforcing kind of the traditional power structures by the plans that are implemented is what is being called an equity impact assessment, similar to a health impact assessment that has been used with environmental assessments. And that health impact assessment, and there are tools for doing health impact assessments that you can find online. But that health impact assessment will need to include kind of the diverse community interests. And included within that, I would say, are community organizations that not only provide services to communities of color, but community organizations that have been focused on removing or addressing kind of institutional barriers. And by institutional barriers, I mean institutional barriers to banking, for example, institutional barriers to housing, institutional barriers to employment. I mean, bringing together people who can think forward about what is the likely outcome of these decisions before they're fully implemented will help to assure that in the long term, once the funds are allocated, they will help to achieve the equity goals that we seek for them to do. The fourth principle was broadening the pool of eligible recipient organizations. So Jeff already talked a bit about like changing the power dynamics in a community. Typically government funds many of the usual suspects, including, academic institutions, because they've got the systems in place, they know how to write the grants, and yet, given how we want and we expect these funds, the goals we want these funds to achieve, we may need to start thinking outside the box to organizations and entities that have not been typically at the table at receiving these funds. And for different reasons, they've not. And sometimes it has to do with organizations lacking the back office support to collect the data. It could be that they lack the grant writing capabilities. But to assure that we really are reaching the recipients who can make a difference, can have an impact, then we're going to need to think about how we can do things differently. So the point of this is that who is funded is as important as what is being funded. The last principle. So the last principle focuses on government collaboration across agencies and with community. We've already talked a little bit about collaboration across sectors. Well, government agencies often are defined to relate or similar to the sectors that exist in our society. And many government agencies function in their silos. And if we have not learned anything from this pandemic, we certainly have learned that we have to begin to do business differently. And what we've talked a lot about is the technology, and certainly doing business differently, using new forms of technology is a part of this, but also moving out of our silos to reach across the aisle to other government agencies that have the potential to do work or already doing work and maybe serving and working in some of the same communities that health sectors are working in is one of the lessons I think that we have learned from the pandemic and that we've got to continue. Now, it means when you work across agencies that you still have to learn to listen and build trust. I mean, just as we're working with communities. I mean, if we're talking about health, working with the criminal justice system, there's just a different mindset. There's a different language. There's different training, and so it means that collaboration to really make it effective means that we've got to work harder to build the capacity to work across agencies and then with community. So within the paper, we talk about for that collaboration to be real at the highest level, it means states or counties will need to identify a lead. It needs to be, maybe the person doesn't have the name of equity officer, but it needs to have to be someone who has that responsibility, who at the highest level of the state cabinet level can help the agencies communicate and coordinate with each other. We also talked about being transparent in the reporting so that there's real-time information available. Perhaps it's a website that can report what are the activities and the efforts that are being funded, who is being funded, for how long, what efforts and what goals do they seek to achieve. So all of that, I think, is an important principle of how we want to help assure that the funds are being achieving their equity impact. Now, in closing, let me say we are well aware that developing, implementing these principles will be a lot more complex than developing them. State and local jurisdictions will vary in the process as well as the pace. And based on data that has been compiled by the National Academy for State Health Policy, we now know that there are at least 5 states that already have developed a plan for how they will use the American Rescue Act funds. And there are a dozen or so states that are partially, a dozen or so states that have not even begun at all. And in the middle, you've got states who are partially, allocating allocating the funds. Communities, however we define them, may face challenges in interacting with government in how they are allocating these funds. And I was in a meeting just 2 weeks ago where we were talking about some of the challenges that communities have faced with states that have gone directly to their legislatures to develop a plan and pass bills of how the funds would be spent. So the obstacles that communities will face are challenges, but they are not challenges that can't be overcome. And so the principles and the policies and the system supports that we have identified in this paper are intended as a framework that can help turn those obstacles into opportunities. And so that's why we're here today, to help talk about how communities can better interface with states as they are making decisions about allocating these funds, so that we can assure that the Rescue Plan Acts actually are used to address longstanding racial inequities in health and in healthcare that have been exacerbated by the pandemic. So with that, I'm going to turn it back over to you, Jeff, to move forward.
Well, thank you, Marcia. And we're beginning to get some comments and questions in the chat that I think will help us address some of those challenges. People are doing a very good job of articulating some of those challenges. Just one sort of contextual thing that I think is worth mentioning because I think it's important, and that is this level of funding from the federal government directly to localities is unprecedented, in that the fiscal relief money is going not just to states and large cities, which is the normal way you see funding flow, but it is going to almost every city, town, village in the United States. That raises all sorts of practical issues of some of these smaller communities never having managed federal grants before. But it also opens the door for different types of community participation. Because if you're starting from scratch in dealing with this, it's easier sometimes to create a different paradigm than places that have always been doing it this way. But I think we can come back to some of those issues during the discussion section. But let me turn it now over to Javier to provide his perspective on these issues.
All right, thank you, Jeff. And Ms. Marsha Lily Blanton. Really excited to be on this panel with you all. Appreciative of the sponsors of this panel. You know, this issue of centering community and equity, it's a huge one, and you know, it's the best way to say this. We can't keep doing things, and you kind of said this, Jeff, earlier. We can't keep doing the same thing we've been doing and expect different results. And this, we're at a monumental pivot point right now with this magnitude of funds that are coming in. And you know, it would be catastrophic if we couldn't make change in this period. You know, seeing the struggle that's going on right now in the Congress, passing some of these later infrastructure bills, you know, we're just seeing the tensions that are out there. So just before I make comments, I actually do have a PowerPoint, but it's not a, I'm going to just bounce through different slides because I want to respond to the points that were made. But first of all, just so folks know who I am, let me see. All right. Here we go. I'm with the Praxis Project. For those who don't know us, we're a national nonprofit that works with community organizers. You know, our mission is to build healthy communities by transforming the power relationships and structures that affect our lives and our communities. And this pivot point that we talk about, it aligns with this talk about transforming the power relationships. How can we leverage this funding to be able to come into our communities and change the way we do business? I'm coming to you from Berkeley, California. It's Ohlone lands. We always make it a point to talk about where we're sitting, because the original stewards are still here. They're not invisible. And so we always do a little bit of a shout out for the great work that they're doing to still protect the land and steward the land. I wanted to talk about, you know, when we talk about equity at Praxis, and we talk about the determinants of health, this is the framing that we use right here. And all of you are health professionals, so you guys know social determinants and policy backwards and forwards. I'm just only presenting this so that you can kind of understand the frame that we use. So for us, you know, this is the ideal. We want healthy people and we want healthy communities. And we know that in order for that to exist, all of these factors that are down in the root system of this tree have to be robustly present. When they aren't robustly present or unevenly present, you know, we have poorer health outcomes, we have lower life expectancy, and you know, it's not good for communities that have been traditionally marginalized. I love that the report that came out, and I forget exactly the name of the report that you mentioned early in this presentation, Jeff, but where they actually called out structural racism as a public health issue. So for us, when we look at this ideal right here, and then we go back and look at to what's really happening, you know, we see that the outcomes that we have are not even. They're very uneven. You have some communities that are very benefiting a lot, and you have some that aren't. And it's a lot of it's due to how robustly present or absent these determinants of health are. And so when we talk about equity, we think of equity as an outcome, but we also think of equity as a process. And you know, these determinants, they're really they're robust. The level of robust presence or absence, that's really an indicator of equity, of health equity, especially in an area. But if we only continue to deal with the outcomes and we don't deal with the systems, the structures, the policies, and the practices that lead to those outcomes, we're really not getting at the root cause, and we're not going to have significant change. And what I've learned when we talk about climate change, we talk about obesity prevention, chronic disease prevention, preventable chronic disease prevention, housing and homelessness. What we really see is that those system structures, policies, and practices are entrenched, and there's a power that's out there that's keeping that the way it is, the status quo. There's a very strong profit motive in keeping it the way it is, pharmaceuticals as well. There's a very strong power that is working in our legislature and working in our federal legislature and our community councils and our state legislatures, trying to protect what they've got. And a lot of times this is it's not benefiting communities. In fact, it's making it worse for us. And so it's about the power to keep this system status quo. And so the way that we're going to offset that power, we feel, is through community power, building community power, going out, doing advocacy, raising consciousness in the communities, activating communities to learn about the root cause. You know, a lot of times when we talk about prevention, we start with where we're at today, and we don't really talk about how we've come to be there. And when we don't do that, it's actually a disservice, because it just starts to kind of frame and label people to be a certain way. But it's really the structures and the systems that have led us to be here. We have to acknowledge that. And by raising that consciousness, we get people motivated to get involved and to participate and to get us to where we want to get to. I appreciate these 5 concepts that were brought up, because in my mind, and from my practical experience, working with empowered communities that have strong relationships with public health departments, planning departments, other local government agencies, you actually can move a lot of issues and change and transform some of these systems. And when I think of the groups that come to mind, I'm thinking of SCOPE, Strategic Concepts and Organizing and Policy Education down in Los Angeles. They're doing incredible work. They're a base building organization that gets their priorities from their group, and they all work together to change those policy systems, practices that underlie the inequities that they're trying to address. And they do that in collaboration with the government offices and agencies. I think of the Southwest Organizing Project in Albuquerque, New Mexico. I think of West Harlem Environmental Action. I think of Little Village Environmental Justice Organization in Chicago. I think of SMASH down in Miami. I think of Got Green in Seattle. There's base building organizations that already exist, that have the pulse of the community and are ready to come into an authentic collaboration. But this is where it gets a little bit tough. And I like the principles. Inclusive decision-making process, yes. Meaningful commitment, meaningful community engagement and participation, yes. Implementation of funding decisions, yes. Broadening the pool of eligible recipients, yes. Organizations, yes. Government collaboration across agency. I'm going to talk about the first 4 right now. And Praxis, we have our own principles that we came up with, because as our government and national advocate partners are wanting to come in and partner with some of our community organizations, they kind of come in like bulls in a china shop. They have great intentions. Everybody wants to change the world. We want to get rid of structural racism. We want to get rid of those systems and processes that have led us to where we are today, but they don't really know how to authentically work together with community. So, we developed these principles, and some of these align with what you all just covered, acting with care. We lead with love here. We proceed thoughtfully. This principle right here actually came out of the whole move fast and break things. That doesn't work when you're trying to build power, build collaboration, build partnerships. You can only move as fast as the speed of trust. I've heard that said so many times that I don't even know who to attribute it to anymore, but I wish I could. I thought it up, but it's not my original thing. So act with care. Inclusivity. So this aligns directly with that first principle that you all mentioned earlier. Those most affected by the inequities are the best positioned to define the problem, design appropriate solutions, and actually something where we kind of leave off sometimes, they should be defining what success is. Sometimes success isn't Z. Sometimes the success is M and P and T. In communities, when we work on these really big issues, we know that we're not going to reach Z, but we have to get towards Z. And because we don't get to Z in the grant period, the 2-year grant period, doesn't mean we failed. It means that we're getting there, but the community should have a hand in helping to define what success is. Authentic community collaboration, you guys have that too. Meaningful community engagement and participation. Yes, it's important for folks to, in the past, I've seen that we invite diverse folks to the table, but when the time comes to actually talk about the issue and to propose solutions, it's like voices are kind of shut down. And so it's important to make sure that we are doing authentic community collaboration where their voices are heard just as loud. And sometimes some of these groups, like the ones I mentioned earlier, they actually might come to the table, but they won't just offer up an opinion right away because they have to go back and check with their base. So any processes that we're putting together, we should probably try to incorporate that into our process as well. Sustainable solutions. Let's talk about sugary drink taxes. Raising the price so that price sensitive folk substitute something that's cheaper. Yeah, that sounds like it's a great way to address the type 2 diabetes in our communities. But what if instead of focusing in on raising the price so poor folk can't buy it, and instead focus in on let's take that revenue, let's tax the corporations, that are distributing this in our communities, and let's distribute that revenue into our communities for ground up programming, leadership developments amongst youth, addressing the root causes, food security, hydration, healthy hydration. That's a more sustainable solution than the other way. And we need to expand how we're thinking about some of the things that we already do to ask ourselves, is this sustainable and how is it sustainable? Does it help communities to build capacity, a capacity that's going to last beyond the grant period, or is this just going to work during the grant period? Again, we already talked about authentic community collaboration. I think I went the wrong way. A commitment to transformation. This is the last principle. This one's important. I know that I've come into a meeting often, and if I come in thinking that I have an outcome that I want, and I need to get the group to where I want them to go, that's not really me coming in open to transformation, that there might be some better ways to do what it is I'm trying to do. And the same way for the community member that comes to the table. It's important for them to come in with a learning mind frame as well, because there may be something, there's a way that we can meet and we can learn from each other and come out with an even stronger solution that what each of us would have come up with on our own. So, for me, as I looked through this, as I heard the presentation, I think we're kind of on the same page. I would focus a little bit more, and I don't know if these are words that we can use in big reports, but I would focus in on talking about building community power, helping to enhance that power, building organizational capacity, strengthening collaborations at the local level, making sure that what we're doing does leadership development, and that we're raising communities' consciousness about how we've gotten to be where we're at today. I think that if we have a program that can incorporate these kinds of things in addition to the principles that you all have outlined, I think that we are going to get, it is a pivot point. I think that we are going to be able to come out of this a little bit stronger than how we came in. Thank you. That's it.
Thank you, Javier. That was a great additional framing to this work. And we have a whole bunch of questions in the Q&A that I'm going to try to organize. But before I do that, I do want to observe that none of us are suggesting that this is an easy process. This is very hard work. And I think Javier's comment just now was really important. This takes time. It takes time, and we won't always get it right. But the important thing I think we all agree on in this panel is that we need to start. And the American Rescue Plan Act money is one foot in the door. It's a very big foot in the door in the sense that there's a lot of money at stake. And so it's an opportunity to frame a conversation. But we framed it around the Rescue Plan Act in part because that's the immediate opportunity. But we also describe this as something that can be applied across the board in federally funded efforts and privately funded efforts. And, I think we may not have specifically used the words building community power, but I think that is really what we were talking about. And it will take multiple types of investment to build community power. The part of the paper we didn't talk about, and it is one of the questions that arose in the chat, is the kind of support that both government agencies and community-based organizations will need to be able to work in this environment. I think that's something the federal government should do, but that's also a role for philanthropy and for other types of funders to really invest in building that capacity and understanding, I think, Javier, what you said, that's really important. We're not going to get to Z in any particular grant period, but moving across that spectrum, moving is incredibly important. And, we have to recognize that different communities are going to start in different places. And so the starting point for building community engagement and community power is going to be very different in different places. And I think it was really great, Javier, that you could just cite a long list of communities where this activity is already taking place. I would say that our work at the Funders Forum and Accountable Health also provides a long list of communities where setting a different kind of table has actually become the work of those communities. And so that, I think, is also very helpful to be thinking about. And the last thing I would say is we can do it. We have done it. And the federal government has in the past motivated it. So I got into public health work through my HIV work. And the Ryan White program passed in 1990. That was a long time ago. Mandated community empowerment, mandated that communities be at the table, not just to plan how this money would be spent. This is services, HIV services money in communities, but also to help make those funding decisions. And it was a broad spectrum of community. It was those affected by HIV, it was community-based providers, it was the healthcare system, it was public health, it was everyone who needed to be at the table to provide the comprehensive response that people living with HIV needed. And so the federal government can mandate it, and the federal government actually set a deadline. People had to do it quickly. And yes, it's hard, and sometimes it worked, and sometimes it didn't. But it's also but I think it shows that the federal government can motivate that kind of thing. I am reminded that the Roundtable on Population Health Improvement had a 2-day event in January 2021 that on building community power, and I don't have the power to put this in. Well, I suppose I could put the link in the Q&A, or do I have the link? I don't know how to do that. If Alina, maybe you could do that. Okay, perfect. Shared. Excellent. Thank you. And that obviously would be incredible and a very useful resource, and a report on that is forthcoming. So I want to start taking some of the questions and comments, and maybe start with this one, which was identifying this tension between speed and building trust and doing a even if you have trust, doing a consultative process. So I'm asking, I guess, Marcia or Javier, how do we, obviously there's an incentive to spend a lot of this money, although it can be spent over multiple years, and a lot of pressure to pump this money into the system, probably even more now than 6 months ago, given the administration's concerns about where the economy is going. So how do we balance that tension, or is that tension real?
So let me start by saying first, yes, the tension is real because while the funds, we have till 2024, I think, to spend these funds, decisions about allocating them are in process now. But one of the reasons I would say we talked about trying to make sure there's a high level cabinet official in government, whether it's the state government or the local government, within the tribal community, as that there's got to be someone within government who is committed to the equity principles that have been laid out, who can then help to balance that speed with that engagement. And, Jeff talked about his experience. I've had multiple experiences as well, both with Medicaid and with public health, where you have advisory boards, which, trying to get their input really heard and their engagement real is a challenge. So having that senior person, while that's not panacea, that won't, immediately answer all the questions, that's a start. Then I would say trying to work with legislative officials, because the 5 states that have developed plans have, at least 3 of them that I know of, have from the executive branch to the legislative branch agencies enacted bills that broadly defined how these funds would be spent. And one of the things we do know is that, legislative staff tend to listen to and hear from their constituents, and, reaching out to, I wouldn't say slow the process down, but to make sure that that process is inclusive is something that you can do if you find that the executive branch officials that you're communicating with aren't sensitive to that. So there's no easy way to make sure that the timelines don't move faster than what community engagement can happen. But those are at least, 2 examples or suggestions that I would make.
Javier?
For me, is in those places that already have base building organized groups, going and developing that trust there, because they already have the trust of the community. And so, starting there. And in the places that don't have strong base building communities, that it's going to be a little bit harder, but what can you do? It's like, can you hold open forums? Can you find faith groups that might be doing this work, but they're not doing it as organized as other places? So, being intentional, but it's hard because nobody likes to see an expiration date on funds coming through. The pragmatism side of us, nobody likes to see that. So I think that just if we have a lens, just in anything that we're doing, like the first thing we do is like, okay, how do we center authentic collaboration with community, authentic engagement, authentic, building power, if possible, can we do that? So as long as we have that lens at the beginning, then I think we do the best we can. Yeah, with an eye towards, let's not replicate what we've already got.
So we have a few related questions. I'm going to try to pose them together, although they maybe only in my mind do they go together, but I'm moderating. So the first is a question about as part of a state government entity, we want to provide space for grantees to work on community power building and engagement, but we find that funding is pigeonholed to an issue or substance that is further downstream. What communities need to work on social determinants of health, we can't always fund due to federal specifications. And that is absolutely true. And that is why we focused on this fiscal relief money.
Right.
Because the fiscal relief money is so unusual. It is not in the traditional silos.
Right.
And because it's not in the traditional silos, states and localities can be creative in doing that. Now, there's a whole separate discussion about should there be an actual funding stream that is devoted to building community power? I would say yes. We had made attempts in the Affordable Care Act to do that with things like the community transformation grants. There is in the fiscal 22 appropriations bill $153 million for CDC to support multi-sector partnerships around addressing social determinants of health. So I think there is the possibility of doing this. But I think that's what's unique, I think, about this fiscal relief money is that you really can, if you choose to, think about it upstream. But I would also come back to what I said at the beginning around what Secretary Buttigieg was saying. How you frame the use of this money and how you invest in decision making. And I would add that the Treasury Department says you can use this money to support community participation, to support a collaborative process to making decisions. So again, this is unusual flexibility, and let's hope the Department of Transportation does similarly with its infrastructure money. Because if you're serious about remedying the past structural racism that was baked into prior transportation programs, then you have to build in the processes that will help identify and unravel those situations. And we have another comment here.
Can I add to that, Jeff?
Yes. Oh, please. Yes.
So
go ahead.
From my experience working with communities, they use issues to build the power. You don't just like come in and say, we're going to build power. You use issues to build power. So for example, in the Central Valley of California, in the Tulare County area, there was a county park that didn't have goalposts, soccer goalposts. And the reason they didn't have soccer goalposts, it was a rural area. The reason they didn't have soccer goalposts is because that attracted a type of person that they didn't really want to be coming to the park. So you had residents that actually came together and they got trained in how to go in front of the county commissioners and to advocate for these goalposts. And so they ended up winning the goalposts. But that was today. But now they've got this capacity, they've got this trust, they've got this these relationships, and then they moved on to the next issue. They didn't stop there. So I think that probably no matter which particular area folks are working in or giving grants in, that there's a way to structure those grants to build that infrastructure while they still advance the issue that the funder is interested in supporting.
So we have an additional question, which really gets at the core of what we're trying to talk about, which is from Marguerite Rowe, that we have a major challenge that we are facing with the use of federal funds is the ability to focus on communities of color that have experienced historical and ongoing systemic racism. We're able to support low-income, economically disadvantaged communities. Do you have any advice for using the federal dollars in a more straightforward manner to address structural racism? To be clear, the challenge is the threat risk of lawsuits targeting our use of dollars. That's a tough one.
Oh, yes. And I personally, I know Marguerite, so I appreciate your having us to think hard and long about some of the challenges we will face. I think what's good about these dollars is that the administration has made it very clear that they can be used to address structural racism. And that's unusual. I mean, we haven't seen that in the past. so while I think previously there was certainly a threat and a fear that there could a federal government or a private organization could be subject to suit. I think these funds give you more flexibility than we've had in the past. And particularly as we look at, the root causes of structural racism, so if we're talking about trying to actually, like Javier's thing about looking at how, some communities have roots that are stronger and weaker than others. So sometimes you could look at where those roots, need to be strengthened. And, I talk about housing a lot because I think that housing is, a key one of those roots. And so in some cases you can target the housing itself and how housing historically and current day continues to disadvantage communities. So sometimes you can, and one more thing about what's the advantage of these funds. The uses of these funds are presumed to be acceptable if they are in what's called a qualified census tract. And those qualified census tracts have been designed based on low income and communities of color. So I do think that these funds are being targeted in such a way that some of the challenges we faced in the past won't exist, and some of the risks that we faced in the past won't exist to the same level. Now, I won't ever say never, because we are seeing, I think some, the politicization of issues at a level that we haven't seen since the 60s. So I think there are risks. So I don't ever want to say that there is no risk, but I do think these funds give us flexibility that we haven't had before.
And Javier, I wonder if you could expand on that and maybe also bring in the notion of, in your work, sort of how you bring communities and leadership along. That, there are going to be communities where you are not necessarily going to start the conversation about equity with structural racism. You may start with social determinants of health or whatever other lessons that community may have taken from the pandemic experience.
Yeah, thanks. And unfortunately, if you just use the data to see the areas that are experiencing the highest rates of inequity, the least infrastructure, the least robust, the most food insecurity, it's typically going to be, the communities of color, unfortunately, or low wealth communities as well. And so I think that a way to be, so it's how you structure the funds coming out. What are the criteria, on how they go out? And I think that by addressing the places that are experiencing the worst outcomes, if that's one of the criteria, you don't have to talk about structural racism, because it's going into the areas that are experiencing the worst outcomes. And then the second piece is, if you have a really robust engagement and collaboration process where the folks that are closest to the issue are the ones that are designing the solutions, you probably are, and you probably are going to get at some of that systemic the paths, the systems that have caused these outcomes. And you don't have to call it systemic racism. It just depends on where you're at, and you got to meet communities where they're at. But I think it is possible to do this, but it comes down from how we structure those funds going out, and what are the requirements for it. And that lens, if we have that equity lens from the beginning, that will help determine where the funds go, what they can do with it, and how they need to come together to make those decisions. And then as far as going into different neighborhoods or communities, when you show data, and unfortunately we don't have a lot of data for some of these things, you got to really disaggregate it sometimes. But when you show a lot of the disaggregated data, a lot of folks don't really understand how much of a spread there is. And by coming in and leading with that, and then talking about how we've gotten here, I think that brings folks along. As far as like forming the relationships between community and some of the agency staff, the agency staff have to be open to it. There's usually someone that is. I mean, I don't, this is the hard part, because there have been some areas, like there was this one county in Central California again that was not actively going out and getting people signed up to SNAP because they philosophically didn't believe in it. And that's where it's hard. And that's where maybe you have some other upstream types of regulations that say, okay, well, you're not going to get fund X or Y or Z funding unless you are doing this kind of outreach. And it's not good when you have to get to that level, but I think that in some areas you do have to get to that level.
So we have a number of questions that relate to sort of the kind of technical assistance that's needed, how to help smaller communities, and and one really interesting comment about, and it's an important one, that how can there be some cross-border, in a region, some of the smaller communities getting funding, actually the funds can be so small that it's hard to do something really meaningful unless you combine funds across borders. And I know the National League of Cities is doing some work in that regard. But maybe, Marcia, you can talk a little bit about what we have in the paper around sort of the kind of program and policy support that might be needed to help communities do this. Because I think we recognize that this is not necessarily going to spontaneously occur.
Right. So I would say in the paper, we call for exactly what's being asked, which is that we've got to create, real-time clearinghouses of community practices. We need to create toolkits for how you can engage with communities. The technical assistance issue that I think is being raised is one for back office support, data collection. And while some of this can happen at the federal level, I think this is where this push and pull from the community to the state or local government will have to assure that the technical assistance and support is available. In the paper, we actually talk about OMB issuing guidance so that, that allows states and counties and localities to feel more comfortable doing this collaboration as well as providing this technical assistance. But just as community-based groups have some fear about or concerns about being held accountable for how funds are being spent, governments do as well. So one of our speakers could have talked a little bit more about, who didn't make it, how Indiana has handled this. But I do think that creating back office support at the level of government, and it is something that will, in the long term, will help sustain the efforts and the programmatic efforts. But it's not, I think what we're doing now is encouraging and saying what kind of supports could help and are needed. But I don't at all want to say that we've got the answers for how to make this real, because it really is going to take pressure from the ground to the local governments. But what we've done is made sure that you're aware. I mean, there is, through the National Conference of State Legislatures, through National Academy of State Health Policy, there are entities that have defined what funds are available, but the supports that will be needed to actually assist community groups in applying to create those kind of meaningful engagements is something that's going to have to come from those base organizations that can apply the pressure to get state governments to, open up. And what we're doing is trying to make sure that everyone knows that these resources are available. But we, like you, think that there will be obstacles. But once you're armed with the information, that these resources are available, then you can begin to knock on the doors. You can begin to demand that they be more transparent. you can demand that they engage communities, and sometimes the more influential communities might be the first ones that bring to the table. But many of the agencies have like advisory board processes. So, whether the advisory boards may not be directly involved in these allocation of funds, but at least there's someone there that's willing to listen to people from the community. And so that, might be the like step one if there is no equity officer. I mean, first of all, I think if there's an equity officer who is a cabinet level appointee, that's the first place to go. But if there is not, then trying to go and interface with the advisory board where there is some community participation, or at least where by law or there is expected to be a community participation, that would be the next level of entree. But I, so I think that's, just in general, we've tried to identify them, but we've not given hard and fast solutions that will make this engagement real. There's a long history of why government does business the way it does, and trying to change that in the time period we have. It's not likely we're going to fully change it, but as Javier said, I mean, sometimes you want to set a goal, and maybe that goal is not getting to Z, maybe that goal is getting to S, of engagement, and say that that's part of the success of how we use these funds now, with the goal of later getting to Z.
Yeah, and I think I would reinforce that Kara Herring, who was supposed to be on the call, would have been on this webinar, would have been an example of a state that has made that commitment to bring that equity lens to the work across cabinets. It's not just an equity where we've seen that kind of collaboration across agencies. It's also, a number of states have children's cabinets that try to do something similar. So it's not unprecedented to have it. It can be unprecedented to use this equity. It's unusual, or it's relatively new to use this equity lens. And it's also unusual to be reaching out in a broad way in communities, but other states are doing that. Some of the plans at the state and local level are pretty inclusive. Rhode Island is using a participatory budgeting process to make some of their decisions. So that's just one other example. Going back just to the TA thing for a moment, I also think that, our Funders Forum brings together public and philanthropic supporters of this kind of community power building and multi-sector partnership work. And there's a role for philanthropy, and particularly community foundations in smaller jurisdictions, to really play a role as a convener, and as a TA provider, and sometimes as an intermediary to help organizations spend this money in accordance to federal guidelines that could be complicated for smaller community-based organizations. So I think there's a role for philanthropy in helping, in assisting, and sometimes in putting pressure on government officials to be more collaborative in this way. Javier, do you have any thoughts on this?
I immediately went to community foundations when we were talking about this earlier, because they just have, they are embedded. They also have, they're powerful. They have sway with the legislators, with whoever's designing the guidelines for how this funding is going to flow down, and they have the trust of the community. They have the reach. They probably have funded almost every group that would probably need to get funded to help with this pivot. And many of them do offer technical assistance already. So, that's directly where I went. Yeah, so I don't have anything else to offer besides what you said. So, but they're a natural partner.
Mm-hmm. So I also want to raise a comment/question from that around the role of public health. And Bridget Kelly comments and asks, the allocation of resources tells a story that reflects the values, assumptions, and mindsets of the system. To help implement the principles, what principles would you add to help influence public health's entrenched assumptions and mindsets as a major upstream driver of resource decisions and other power dynamics? And so now I can take the next hour and extend this webinar and go do my speech on that one. But I think there is a short answer to this, which is, but an important one. You know, the pandemic, as much as any other sector of American government and American society, the pandemic has highlighted the challenges that public health faces. And the biggest challenge, there are, funding challenges, there are workforce challenges, there are structural challenges around we don't have the right surveillance systems that will tell us what we need to know about how to target money and how to target interventions, all those other things. But I think the most but I think what has emerged from this pandemic is a recognition that the public health system as currently constructed is not meeting the needs of the communities they are serving, and does not have those core capabilities that are central to being able to respond to emergencies like a pandemic and sort of the ongoing emergencies that we face. Now, there are more and more public health agencies that are declaring racism to be a public health issue, but there are also public health agencies that are in the crossfire of a very polarized society, where it's really hard to do some of the basic public health work. What's exciting to me is the degree to which, unlike past emergencies, the federal government seems to be on the cusp of providing long-term funding for rebuilding public health. There's $3 billion in the Rescue Plan Act that still has not been spent, that is specifically targeted for rebuilding the public health workforce, and it is no year money, so it could be spent over 3 to 5 years. And in the current version of the Build Back Better bill, there's an additional $7 billion to build public health infrastructure. And it's in this legislation that Congress is specifically saying that the capacity to address equity issues is a foundational capability of public health. Does that mean we will overnight transform public health? No, but it is also the first time, and again, this is money that would come over, that $7 billion would come over 5 years. This would be the first time in a post-emergency period that we would be seeing sustained funding to try to rebuild public health. In a very decentralized public health system, it's going to require much stronger leadership than I think we've seen in the past from the CDC in giving direction to states and localities, but it will also require incredible work at the state and local level to make sure that communities are part of this redesign. End of speech.
Can I react?
Absolutely.
The public health field, I think, there's a lot of promise in that being like the vanguard to achieving equity. But I from practical experience, what I've also seen is that they can be as progressive as their most non-progressive county commissioner or city councilor. And so I think that this notion, or not this notion, but the collaboration between the public health professionals and the community really needs to be strong. Otherwise, some of these equity initiatives that folks want to undergo, and we're ripe to undergo them right now, as soon as we have a change in leadership, they can die if that sits with public health as opposed to sitting with community. And the community can actually be the advocate to make sure that public health continues to be fully resourced. So again, it comes back to community and making sure that they're at the table. And I feel like public health, we've gotten really good at doing research, doing advocacy, doing surveillance. There's a number of things that we're really good at, but there's one pillar there on the community engagement. And traditionally, I think we haven't gone there because it's messy. when you go into especially communities of color that have, 300, 400, 500 years of struggle, those first few meetings that you have are basically, you got to sit there and just like absorb it all. And a lot of times we don't come back for that third meeting because it's just like, oh man, it's not going anywhere. We can't keep up with this. So, there is a challenge also. We need to re-pivot and redefine how public health does their work. And we've got allies out there. The equity goals that traditional public health has are the same equity goals that community has. We might just not call them the exact same thing, but we're allies. We need to be working together.
And the other element of the federal legislation in defining public health infrastructure is community partnerships. And you can define community partnerships all sorts of ways. And so we'll have a responsibility, and CDC will have a responsibility in helping to define that very clearly, that yes, it does include how does public health work with healthcare and chambers of commerce and the like, and that's important. But it is just as much public health building partnerships with the community and not just the different sectors. And I would argue when you look across the country, even in very polarized environments, the health departments that have had relatively greater success in being able to get adoption of appropriate public health measures or evidence-based public health measures have been the public health departments that have engaged systematically in partnering with the communities, because just as you said, Javier, there was therefore a community voice that could respond and advocate with a county council or a city council or whoever was a decision-making body in a way that was not possible in other communities, because there just wasn't the time, there weren't the resources to invest in those kinds of community dialogues. Well, we are getting close to the end of our time, and I want to quickly, scan. Some of these other comments. One comment is, what do you think the role of community action agencies should be with ARPA organizing efforts? That's another. There are so many potential starting places. It could be community action agencies. It could be area aging agencies. There are just so many different focal points. And the trick, I think, in each community is finding who is, who's already beginning to do this work and has those relationships that can leverage that. I don't know if Marcia or Javier, you have other thoughts on that.
No, I don't.
Okay, so I probably haven't gotten to every question, but I think we've covered a lot of what was asked. Just want to turn to Marcia and Javier to see if you have any last thoughts, something that has triggered in your mind that we didn't get to in the conversation.
Yeah, the only thing I want to say is that I think our big message is that we know that there are obstacles to changing the way government does business. But we also think that we've got an incredible opportunity with the funds available. And so using this opportunity to tear down some of the obstacles, some of the barriers, is what we are encouraging community-based groups, communities writ large, and to some extent, even local governments who will have to advocate for resources they think are needed from their states. So we just think this is an opportune time for us to make real headway in addressing inequities that have been longstanding. And so we just want to encourage and support those of you who are here today, and I hope that 5 years from now, we'll see that we made some difference with this investment of funds.
Javier?
Yeah, for me, I'm hopeful. I'm an optimist. I'm hopeful. But these kinds of dialogues where we start to question the status quo, and then there's an opportunity here. There's a pivot point. There's resources to pivot. So, the more we can hammer in, it's like we're on the same page, community and professionals, we're on the same page. We want to achieve the same goals. A lot of the system structures, policies, practices that we need to transform, neither of us have been able to do it alone. We need to be working together. And we gotta be able to work through that uncomfortableness that's going to happen because we haven't practiced at this for so many years. We're going to have to be uncomfortable for a little bit. We can't take things personally, and we gotta like keep coming back. We gotta show people that we're not just showing up because we want something. We're showing up because we're truly invested in the health of and the opportunities for health for everyone. And people can see that, and they're going to be more willing to partner and work with you. So no, I appreciate, again, thank you guys. It's Veterans Day. Deeply appreciative of all the veterans that have helped us be where we are today. Many of my family members. And again, thank you for the invitation. I really appreciate both of you and others who couldn't be here. I really appreciate their facilitation for me to be here. So thank you guys all.
So, and thank you, Javier, and thank you, Marcia. I guess I would close by saying, besides thanks to the roundtable for giving us this opportunity, the dollars are on a sprint, the work is a marathon, and we need to be seizing the moment. And we all know that there are, we're in a constantly shifting political environment. We have a rare moment where there, as Javier said, there's this convergence of interest, convergence of approaches, and we need to seize that moment. And we hope this conversation has started us down that path. And so thank you. And thank you to everyone who was on this webinar. We had a lovely attendance and a persistent attendance, which is always the big test of whether we keep you interested as we go along. So thanks, everyone.